The struggle to save lives is now tied up with the struggle to find oxygen, and every person in this hospital is part of that fight. And across the Indian capital, it's almost an hourly battle.
Emotionally, we are drained. We have not seen so many mortalities in our ICU as well as in our near and dear ones. I get maybe around 50 calls every day. Somebody asking for beds, somebody asking for cylinders, somebody asking for drugs. We don't have anything available and patients are dying.
India's reported a record number of coronavirus cases for the 5th day running, and they're struggling now.
Every patient in this room is requiring at least 15 liters a minute. That means at this rate, every 3 hours, it's a struggle for us to arrange for the new oxygen cylinders.
They've got nearly double the number of patients in this hospital, and they're expecting worse to come.
The situation is critical right now. This pandemic is the worst we have ever seen till now. And these 2 weeks are going to be a hell for us.
I want you to have a look at this because it's hard to illustrate the scale of the problem with a country the size of India and with the population of India. But this is just what one hospital has done to cope with the rising number of coronavirus patients. And it keeps on rising. They've had to build tents in the car park to cope with the overspill. All these people are suffering from coronavirus. All of them need oxygen. They can't take in any more. And these are the lucky ones who managed to get help.
International help, including from Britain, is on its way, but it can't come soon enough, with patients struggling for breath and worrying if their lifelines will run out.
Sometimes this is working, sometimes this other cylinder is finishing, sometimes 2 hours here they are putting. So they are lowering the oxygen level, though it is needed, that it should be more. So this is the problem.
India's calamity is the rest of the world's too, with a new, more virulent variant called a double mutation, and doctors saying they're seeing alarming resistance to medicines and vaccines.
The double mutant, it bypasses everything. Even the medicines are not very effective on that. So the medicines which were very helpful in the earlier last wave, which we used to give in the mild cases, it doesn't seem to work now.
There are many more people needing much more oxygen, and they're having to beg, barter and buy from wherever.
I'm buying oxygen at the rate of gold. You know, the situation come to that level. It was like 22 rupees per kg oxygen, and today I sanction for 50 rupees per kg. And the black marketing is happening. Remdesivir injection, which is like 4,000 rupees, or 2,000 also, people are buying at 40,000 rupees.
The government is urging its citizens not to panic and not to hoard, but the oxygen demand has risen around 20% nationally, with some hospitals coming within minutes of running out of supplies, so they're not prepared to listen right now. Alex Crawford, Sky News in New Delhi.